Okay, well, hi, it's Dr. Eric Nager from Opti Health Institute, and I am here with my friend, colleague, and my dentist, Dr. Gene Sambataro. So we're
Thank
here.
you.
We're here today to talk a little bit about breathing, sleep apnea, difficulty with breathing, like snoring and things like that. And of course, in the age of COVID, with us wearing our masks, this is awesome. Not an awesome way to have to breathe, but sort of sign of the times. But we've got lots of patients in the practice who come in and they're reporting that their sleep is not restorative, it's not restful, and one of the questions that I ask them is if they snore. So, being a dentist who specializes in airway and snoring and sleep apnea, can you shed a little light on snoring and why it happens?
Well, snoring, for many people think it's, it's something that their older uncle does, after he falls asleep after a heavy Thanksgiving dinner. And there's always a few laughs about Uncle Joe, right, snoring. And we used to think it was pretty benign, but really snoring in the early stages can be benign other than to their partner, which can be very obnoxious. Interesting statistic is that 35% of married couples don't sleep together, and it's because one snores.
I didn't realize it was that high.
Yeah, so that's pretty substantial. So, but what's happening when you snore is you're actually blocking partially the airway, not completely. And that's what causes that vibration in the back of the throat.
Now, snoring can sometimes be thought of as the canary in the coal mine for things that are more serious, isn't that right?
Yeah, so we always want to check that. But I'm saying if it's just snoring and they don't have sleep apnea, so they've been tested with a sleep study, is that ultimately chronic snoring will lead to sleep apnea because of the vibration causing permanent or chronic changes in the back of the throat, specifically the soft palate.
So, how would you evaluate somebody for snoring?
Well, generally, it's in our questionnaire, so every patient who walks in the office is being asked. Of course, many of them deny it. If there's a consultation with the partner, we get into a battle. One says, oh, you snore, no, you snore more than I do. So most people don't know that they snore unless someone tells them. And I'll give you a perfect example. We had a 55-year-old gentleman who, not married, wasn't in a relationship, had no idea. He went on a trip with his family. They recorded him snoring. They said, yeah, no one could sleep because he was snoring so loud. So they recorded it, he brought it in. And I said, this is a serious problem. But, let's don't jump the gun. Let's find out. I believe test, don't guess. So we did a sleep study on him. His sleep apnea score was in the 60s, which is considered severe sleep apnea. So his snoring was actually contributing to chronic disease. So he did have cardiovascular issues and diabetes. So that could have been a contributing factor.
And when we're dealing with sleep apnea, it's one of these things that is a pretty serious entity that's probably under-recognized. So at least from a medical standpoint, when I'm talking to folks about sleep apnea, I let them know that it increases risk of cardiovascular disease, heart attack, because they're just not getting enough blood or oxygen into their system to feed the vital organs.
Yeah, there's many, as you said, many comorbidities that become more serious things. So if you talk about sleep, for example, if someone has insomnia, there's a lot of issues that cause that. But if you have sleep apnea or obstructed sleep apnea, it's called really OSA, obstructive sleep apnea, you actually stop breathing. So we talk about snoring, which is a partial blockage of the airway, but in obstructed sleep apnea, there's a full obstruction. Usually will occur later in the sleep, maybe during the REM cycle. They're paralyzed and they will wake themselves up and fall right back to sleep. The partner usually is looking scared that they're not going to take another breath. That's when usually someone takes some action. So usually when a patient comes into the office, it's because the significant other said, you need to go get this looked at because I'm a little scared that you're not going to take your next breath.
One of the things that always surprises me is when I get patients who come in and I ask them, do you have sleep apnea? And they say yes. And I said, oh, okay, what are you doing about that? And they're like, well, nothing. And the reason is because they've been given a mask and they don't like the way it feels. It's either very loud, it's having all these wires tangled up when it's time to go to bed. And they'll come right out and say, yeah, I have sleep apnea and I don't do anything about it. And the interesting thing is, before I met you, the medical community doesn't really talk about this a lot, but because I was always taught that you had to wear a CPAP mask, either nasal or over the full face, and that was something that could be both helpful and life-saving, and it can be, but it's not the only option. So you had educated me on other options, so talk a little bit about what can be offered to a patient like this.
Especially in today's world with COVID, if you're wearing a mask all day, you don't want to go home, go to bed with another mask on. It's the only time when you don't have to wear a mask. Yeah, so the gold standard is still a CPAP, continuous positive airway pressure. But they're uncomfortable, although I would say over the 30 years I've been doing this, they've gotten smaller, they're more comfortable. They've gone from CPAP to BPAP, which actually measures inhalation and exhalation, or even a APAP, which actually based on their actual inhalation and exhalation. So it's a little more comfortable, but it's something that they have to clean. So there's issues with mold. They have to travel with it. So there are other options. And now the American Academy of Dental Sleep Medicine recognizes that dental or oral appliances are a first-line opportunity for moderate and mild sleep apnea.
Right.
Severe sleep apnea should still be first line of defense, should be CPAP.
Gotcha. So, and some of these folks have actually checked out, they'll get a dental device on like Amazon, and they're like, yeah, it didn't work. So like, what's the difference between that and like what would happen if they went to see somebody like you?
Yeah. Unfortunately with the mask, you couldn't see me laughing about that, but yeah, it really gets me. And the reason being is, and that's the title of my book, is Stop the Snore. Is it's not, if it does stop the snore is actually like a fire alarm. It's like, the light on your dashboard that says you need oil. You say, so do you go put oil in it, or you just undo the flashing light? So when you get rid of the snore, when they use one of the appliances, they may still have sleep apnea. And in fact, many of these appliances, intraoral appliances that you get over the counter, can make the sleep apnea worse.
Okay, so it's important to have it fitted properly and that sort of thing. Okay.
Yeah.
And then as far as the other impediment for a lot of folks for just actually diagnosing sleep apnea is how they get it done. So again, traditional medical model, you've got to go to a sleep lab, so you're going to a foreign place where you don't really know what's going on, you don't feel comfortable, it's not your bed, it's not your pillow, and you're having to go to sort of just a place you're not familiar with. So what are the other options as far as going to a sleep lab?
I think this is the best thing that's happened in sleep medicine, and now you can do a home sleep study. It's very portable. They can do it in the comfort of their home, in their bed. It's a lot less expensive. Generally not covered by medical insurance, although some are now covering it as a prerequisite before they do an actual official sleep study in a sleep center. So it doesn't give you as many parameters as the sleep center, but it's a great screening tool. Take it home. They bring it back the next day or the next 2 days, and it gives us the information. It's going to tell them. It's going to tell us, are they snoring and to what degree? Are they bruxing or grinding their teeth, which is a dental indicator of sleep apnea? What's happening to their breath? Do they stop? How many times do they stop? So there's a thing called AHI, apnea hypopnea index. So if they're stopped breathing 5 times per hour, they're going to have an AHI of 5, which is considered mild. 15 is moderate, and above 30 is severe. And it's also going to tell them if they're bruxing their teeth, because we're going to have these EMG pads on their muscles. So snoring, grinding, and they stop breathing. And probably the fourth thing, which you could certainly elaborate on, is their saturation, oxidation saturation is dropping. Mm-hmm. And we've seen them drop as below 80 sometimes at night.
So just for those of you who don't know, oxygen saturation refers to how much of your blood is saturated with oxygen. So in a healthy person without any issues, 97 to 100%. Anything below 90% is called hypoxia, meaning not enough oxygen in the blood. So that's actually dangerous. So if you're getting below that level, it's essentially starving the body of oxygen.
Right.
So clearly a pretty serious problem, but something with a lot of solutions and a lot of new solutions that are different than the traditional ones.
Absolutely. And I said that dental appliances are something you have to wear in your mouth. That's not that comfortable, but a lot more comfortable than the CPAP. Here's the other real issue, is that some of the appliances that we do, we can actually correct the issue long term. So by changing the development of the jaws and reestablishing good tongue posture, we can actually wean people off these appliances and their sleep apnea is gone. With a CPAP machine, they're on there for life.
Right.
Or what's called a mandibular advancement appliance, they're on that for life. Mm-hmm. So with advancement, we call it 3D expansion appliances, we can actually correct the airway permanently.
Gotcha. So sleep is one of the most important things that I talk to patients about in my practice. Functional medicine, which focuses on the root cause of illness. One of the things that I'm doing when people come in with low energy level or hormonal imbalances or being overweight and having difficulty losing weight, a large part of the exam and the time that I spend with them is spent on discussing sleep. Is it restorative? How much of it are you getting? Do you have sleep apnea? Do you snore? So if you have a sleep disorder, obviously you'd be a perfect candidate to come in for a functional medicine evaluation. I'd love to see you here at OptiHealth Institute. If you're somebody who has a history of sleep apnea and you've tried using masks and it's not working for you, seeing somebody like Dr. Sambataro to look at the architecture of your mouth, look at your airway, see if you're a candidate for another strategy, I think would be a great idea to help you with a chronic problem. So thanks for joining us. We appreciate having you here, and
thank you.
Dr. Sambataro is a great doctor, and on top of that, he's got the best looking socks around, so see him for that reason if nothing else.
We get those on the screen.